How you doing? I'm Matt DeBoe, and I'm here to talk to you another time about light. And here's my book, Light in Medicine. And today we're going to talk about blood irradiation. Most of it's going to be focusing on what's called ultraviolet blood irradiation, but yet there's other ways to do blood irradiation, not just with ultraviolet light. This blood irradiation is pretty amazing, where it can actually inactivate pathogens such as viral or bacterial, remove fungal or parasitic pathogens out of the blood as well. There's basically three different ways that this is done. One of the ways it's done is transdermally, where they put a light either under the tongue or on the wrist. Another way it's done is through taking somebody's blood out of their body, then running it through the light and putting it back in them. And then a third way to do it is actually by intravenously, where they'll inject a fiber optic cable into the blood and irradiate the blood there. And the main two wavelengths that are used are down in the UV wavelength, because they inactivate pathogens, and then also in the red wavelength, which are two different mechanisms. Here, once again, you can see right here on one of my flyers. Let me get rid of that there and show you here my overhead system. Here it kind of breaks down. It's my flyer here that I pass out for the website, the Medical Light Association. Cleans the blood, removes virus, can stop infection, inactivates toxins, oxygenates the blood. There's some amazing stuff about how it can actually inactivate snake venom. Here's a book by a guy named Dr. Douglas, and Dr. Douglas goes into it pretty in depth there. And there's a Japanese doctor he talks about right here. And this doctor, where is it here? Dr. Noguchi, and inactivates both cobra and rattlesnake venom. And it's just amazing, rabies toxins and botulism. This blood irradiation has huge potential, and its potential goes into even biological warfare. And now we have a lot of antibiotic resistance. And how are we going to deal with antibiotic resistance, where antibiotics don't work in some cases? So by irradiating somebody's blood with light, it actually will kill those pathogens. Now, this technology was invented back in 1928 by a guy named Knott and Dr. George Miley. George Miley. And what they did is they treated a lot of dogs until they found out how much blood you could actually take out to irradiate. And what they found is you don't want to take, I think it's not more than 1/16 of somebody's blood, because you'll put them into shock. And in some cases, if you kill a lot of pathogens, you can get like a Hexheimer reaction, where there's so much dead pathogens that people can get sick. So you don't want to do that. You want to treat just enough to treat that. The biological warfare. I mean, if something happened, antibiotics might not even work. So it's amazing what this technology has the potential of doing. Here's another book called Dismantling Cancer. And this guy down there, Francisco Contreras, actually uses blood irradiation to help heal people with cancer. I mean, it's just great technology. So one of the people I interviewed was from Russia, and I interviewed a lady named Dr. Tina Carew, and she's into using light technology. But when I asked her about blood irradiation, she said, well, it's amazing technology. And she said it's kind of an immunomodulation. And one of the things she mentioned is that if you run somebody's blood through the light long enough, within a short amount, I guess 15 minutes, it starts to become very red and oxygenated, and the viscosity of the blood changes. It actually gets more flow. It gets thinner, and it flows better into the tissue. And some of the technology, there are FDA approvals for this treatment, and it's called it's using blood with a light-sensitive compound, and it's called photopheresis. And photopheresis is FDA approved for treating lymphoma. But what's interesting is that There's a lot of other things that this technology can do. And so what's going on is that there's only one approval, hoping that doctors get more studies in to move this technology forward. Some of the developers that built some of this technology are Tommy Perez with Harris Medical, Dr. Michael Weber out of Germany, and another guy named Eugene Barnett. And they have built some great devices to do this technology. And it's just at the beginning phases, and hopefully there'll be more stuff going on with it. But so I just wanted to let you guys know about blood irradiation. Oh, one other thing I want to mention is that the Russians do it, but they do it more intravenously. And what they're doing is they are actually putting a laser optic into the blood vessel, and they're getting great results treating people of all kinds of different things as well. Now it's a different mechanism, but it revitalizes the blood. So lots of great technologies out there having to do with light. Thanks for tuning in, and stay tuned because the next couple segments are going to be pretty wild. Thank you.